Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. This is Awareness for Human Rights and Charity Foundation, based in the city of Jigawa State in northwest Nigeria. Postpartum hemorrhage is indeed the leading cause of maternal mortality in Nigeria, with tens of thousands of women dying annually from severe bleeding and related complications. The Charity Foundation, led by Dr. Awal Awareness, on June 2025, organized a program for blood donation, which is essential for hospital, maternal, and child emergency care. Kano State in Nigeria faces a critical maternal health crisis, which is one of the highest maternal mortality ratio in the nation, estimated at about 1,025 days per 100,000 live births. Kano State has a large population of children affected by this condition of sickle cell anemia. The organization Awareness for Human Rights and Charity Foundation mobilized large number of people, community members, including philanthropists, community-based organizations, civil societies, and health workers, often organizing blood drives to ensure a safe, sustainable, and diverse blood supply to Murtala Muhammad Specialist Hospital in Kano. The significance is that blood cannot be manufactured. Therefore, there is need for community to donate freely, save blood to save the lives of women and children. The initiative is to support blood for postpartum hemorrhages and children with sickle cell anemia. The organization donated 100 bags of blood at Safekeeping Maternity Blood Bank and Sickle Cell Blood Bank at Murtala Muhammad Hospital, Kano. 3 health personnel responded during the blood donation. The donation of blood is organized by the Awareness for Human Rights and Charity Foundation. In his remarks, Mr. Chedi, a head of the blood bank, expressed his appreciation for an organization, highlight their life-saving impact, community spirit, and generosity that provide hopes and humanitarian services.
Good afternoon. My name is Masoud Haruna Isa, a 500 level medical student at here in Buki, studying at Aminu Kano Teaching Hospital here. Alhamdulillah, we are very happy and that we have such type of organizations that usually organize themselves out of their own willing, not being forced to offer these community services. As you all know that here we are living in Nigeria, where usually Nigeria is the place that has the highest burden of sickle cell anemia. In Nigeria, each year, almost 300,000 children are usually born, giving birth with sickle cell anemia, and Kano is the place that has the highest body in Nigeria. To tell you that Kano is a place in the whole world with the highest burden of sickle cell anemia. So if the information I'm just trying to tell you here is that you are going to predict that in Kano State, we are going to have the highest number of people that are in need of blood transfusion. For example, I'm sure that when you go to Murtala Muhammad Hospital, you see a lot of sickle cell disease patients. Their parents are eager, trying to look for where they will get money or where they will get people that can give them blood so as to transfuse their children for their well-being. But they will not get that. So many similar organizations are needed so that there will be community mobilization to tell the people in the public what is the importance of blood donation, to tell them the magnitude of this disease condition we're having, to tell them that many people are there residing in hospitals, not only Murtala Muhammad Hospital, Aminu Kano Teaching Hospital, other private hospitals. We have a lot of sickle cell disease patients that are in need of blood. And this blood can only come from the community because of the burden of the sickle cell disease in our society. So I would like to call on the attention of the community at a large that similar organization, please should be formed, especially among youths, because they say that the youths are the leaders of tomorrow. They should sit together, come with similar foundation that are going to be doing blood donation so as to save a lot of people that are in need in the hospitals. I could remember There's a story about that I know about a lady that has a child with sickle cell anemia. She has been taking the child to hospital for many times in a year. That always whenever she take the child to the hospital, they will tell her that the child needs at least 2 to 3 pints of blood. She no, she used to buy it, give money to get a pint of blood, but because it is a chronic disease, one time she end up having no fund for that. So in that condition, similar organization came and help her, and now alhamdulillah her child is doing well. So this is one of the what importance of blood donation, and inshallah we are going to continue to be telling the community. Also, we are going to engage ourselves. Being medical student, we are going to, if we go back to our own community, we are going to mobilize people, tell them the importance of having such type of organization, and also drive a motion that we are going to be moving to other hospitals within and outside Kano, inshallah, to donate blood.